Hello, I'm Judy Keggy. I attend Casa Sadova's Congregational Church, United Church of Christ, and I'm also on the Executive Council with Pima County Interfaith. I'll be co-presenting for this module involving health insurance and COVID-19. My colleague, Steve Perkins, will also co-present with me. Steve?
Thank you, Judy. I am also on the Executive Committee with Judy and one of the representatives from St. Pius X Catholic Church, PCI Ministry. But first, just a little bit about who we are and what we stand for. PCI believes in citizen leadership. We are intentionally comprised of many religious beliefs, political philosophies, ethnicities, and economic levels. We believe the vast majority of adults have the capacity to speak for themselves and act with others on important issues involving their families and their values. Now, about health insurance and the COVID-19 emergency. This module covers your options if you had health insurance but lost it due to a loss of your job or reduction in hours and income. Also, what to expect if you already have access, and what options are available to immigrants, and finally, what COVID-19 coverage is available if uninsured prior to the emergency. This will also include useful resources relating to COVID-19. Judy, please explain when someone loses their employer-sponsored health insurance when they lose their job. What are their options?
Well, depending on your circumstances, income, and family size, your options may include Access, Arizona's Medicaid program, Kids Care, Arizona State's Children's Health Insurance Program, the Affordable Care Act Marketplace, or ACA, also known as Obamacare, or continuing your employer coverage through COBRA. Go to the Healthy Arizona Plus website, shown here, to enroll in low to no cost health insurance. It will really help to talk with someone about your health insurance options. So schedule a free appointment with a certified assister to learn more. Call the 800 number on your screen or visit the Cover Arizona website connector to set up a time. Assisters can also get you connected to food and cash assistance programs. So let's talk about each of these options. First, Arizona's Medicaid program Access may be the best option for most folks recently laid off. Access provides comprehensive coverage, similar to health insurance offered by employers. It includes doctor visits, hospital costs, diagnostic testing, and prescription drugs for you and your family. You have to be a citizen or an immigrant who's lived here legally for 5 years or more to qualify. Eligibility is generally based on your family income and size, with special consideration for pregnant women, children, and the disabled. If you qualify, you don't have to pay for any premiums or for covered services. You and your family can usually get Access if your family's income in 2020 is less than $17,609 for an individual, or for a family of 4, a little over $36,000 a year. To apply online, you can visit the Healthy Arizona Plus online application portal. The Access Enrollment Information webpage is also helpful. It has a summary of the qualifying criteria, including income eligibility requirements. If you have a disability, the Access website has lots of additional helpful information. And even if others in the family don't qualify, children 18 years old or younger may be able to get kids care coverage through Access if their family's income is under 205% of the federal poverty level. For a family of 4, that would be just under $54,000 a year. Access is recommending that people apply for Access health insurance as soon as they're laid off. In most instances, for initial eligibility determinations, the actual or anticipated income to be received in the application month is what they look at. The application form allows you to indicate that you've lost your income. Now, under normal circumstances, Access includes your income from any source, both earned and unearned, in determining your eligibility. But during the emergency, Access has stated that the additional unemployment insurance payments and individual stimulus checks won't be counted as income when determining eligibility. So that's really good. The bottom line is that lots of things are in flux right now, and there's nothing to lose by applying right away. Help in completing the application is available. Again, we recommend you schedule a free phone appointment with a certified assister for help in enrolling in Access.
Judy, what about if you were already on Access?
Well, if you're already on Access, you know that you have to reapply periodically to continue coverage, or you'll be dropped from the program. But this has changed due to COVID-19. At least during the emergency, Access will not disenroll members, unless, of course, you move out of state, you voluntarily withdraw from the program, or you die. Members who lost Access eligibility in March of 2020 will be notified of their reinstatement. Steve, what's available if your income does not qualify for Access?
If you make more than the income limit for Access, you may apply for coverage under the Affordable Care Act through the ACA Marketplace, also known as Obamacare. If you lose your job, you qualify for a special enrollment period, but you must enroll within 60 days. Family income is also the primary qualifying requirement for receiving a government subsidy of some of your premium under the ACA. This is up to 400% of the federal poverty level. If your income exceeds the ACA limit, you can still get coverage, but there will be no subsidy of any part of your premium. You may also want to consider the COBRA Act and compare those costs with the ACA.
Steve, please explain more about COBRA.
Thanks, Judy. When an employee was covered under an employer-sponsored health insurance and has subsequently had their employment terminated, that employee can continue their coverage under the federal COBRA Act for employers of 20 or more employees. But also, if they're under 20 employees, a small employer, they can apply under the Arizona Mini COBRA Act. Please note you must apply within 60 days of termination of employment. Coverage must be offered the employee by the carrier, including dependents or survivors in case of the employee's death, regardless of health status or other reasons, gross misconduct accepted. You may want to verify if the COBRA carrier, like some, have chosen to waive deductible, co-insurance, and co-pays if you need treatment for COVID-19.
What about immigrants? Can they qualify for Access?
Undocumented immigrants do not qualify for Access coverage, except in the case of an emergency service. Immigrants who have been legal residents for less than 5 years do not qualify for Access coverage either. Immigrants who have been legal residents for 5 years or more do qualify, and for all of the same programs and services that citizens get. They must, of course, still meet Access income requirements to get coverage. Please note, immigrants, that it is that the U.S. Citizens and Immigration Services has confirmed that the public charge rule does not restrict access to testing, screening, treatment, or preventative care of communicable diseases, including COVID-19. Seeking care will not be used as a barrier against those applying for a green card. Judy, may immigrants apply for ACA if they lose their jobs?
Even though they don't qualify for access coverage, immigrants who've been legal residents for less than 5 years do qualify for full coverage under the Affordable Care Act, or Obamacare. And again, if their income is below 400% of the federal poverty guidelines, they can get that coverage partially subsidized by the government. However, undocumented immigrants do not qualify for ACA coverage. They do have one other option, though.
Yes, Judy. Undocumented immigrants can use community health centers for their health care needs.
Right. Though undocumented people are often unable to get access to health care coverage, they can still receive health care through free, low-cost clinics that serve the uninsured. Any of our federally qualified community health centers, for example, El Rio Health Centers or MCH healthcare clinics, are available to care for immigrants. They provide free or low-cost care using income-based sliding fee scales for uninsured low-income families and individuals, regardless of immigration status. And to find a community health center here in our area, you can go to El Rio's or MHC's healthcare websites to find out locations, hours of operation, and any other information. Steve, what about people who were uninsured or underinsured prior to the COVID emergency?
Those employees who were uninsured can always apply for access, assuming that they are otherwise eligible, but they will not qualify for ACA marketplace coverage, Obamacare. Please note, during the pandemic, there can be no charge relating to COVID-19 for testing and treatment of the uninsured or underinsured. Hospitals will be reimbursed for uncompensated care under the CARES Act. Likewise, you cannot be billed for any difference between what the hospital charges for COVID-19 treatment and what the CARES Act pays. These also include surprise billings, withholding of services for advance payment, or unpaid balances. Please also note to call 211 or visit them online if you need assistance with housing or food. This website is also functioning as the state's resource for COVID-19 related questions. Back to you, Judy.
You should also know that Food for Kids is available from our local public school districts. Many school sites have free grab-and-go breakfast and lunches available for anyone under age 18, regardless of whether they go to that school or not. Some districts have food pantries on site at their family resource centers. Some schools hold a once-a-month mobile pantry for their neighborhood in cooperation with the community food bank.
What other services are available?
Here are the websites we've referred to during this presentation, where you can get more details on the topics we've covered. To find these links, go to the Pima County Interfaith website and look for the links there under resources. That's PimaCountyInterfaith.org.
Well, thanks to you, Judy, and to all of you who have participated in our presentation. We hope you have found the information helpful. We'd love to get your feedback on how you are doing and what's been your experience in dealing with the various aspects of the crisis. So please share your stories with us on our website. And please continue to be safe.